A new study through the UW School of Medicine and Public Health is looking at new ways to protect frontline workers during the pandemic.
They're now looking for healthcare workers to join the study. Dr. Nasia Safdar is the medical director of infection control at UW Hospital, and she joins us now. Dr. Safdar, good to see you.
Good to see you again.
Hello.
Thanks for joining us today. So this is called the SHIELD study. Tell us about it and what the goal of it is.
So the goal of the SHIELD trial is to prevent COVID-19 in healthcare workers. We all know that healthcare workers have an additional occupational risk of this infection above and beyond the general public. And so we're looking at two commonly used antiseptics, one applied in the nose and one applied in the mouth, to see if we can reduce the likelihood that the virus will gain entry from the nose and mouth into the body and cause infection.
So these are drugs that are already being used.
These have been used in healthcare for decades. They're just locally applied, so they don't go into the bloodstream, don't have side effects like other therapeutics might, and have been well established.
Very interesting. So who is eligible for this trial?
So any healthcare worker that is interacting with someone who may be known to have COVID or suspected to have COVID or have respiratory symptoms compatible with COVID, because the prevalence of COVID-19 in the community is so high, it is increasingly likely that healthcare workers will come into contact with such patients. So individuals working in nursing homes, dentists, pharmacists, doctors, nurses, emergency services, all are eligible for signing up.
So this is not like a vaccine.
This is not a vaccine, that is correct. This is a preventive antiseptic trial.
And how does it work? Does it catch
There's lab data, and there's additional promising data that shows that both antiseptics have activity that kills the virus. The question I think we must answer is, does it work in humans? We know that it works in the lab.
So what's involved for the frontline workers who sign up for this? How long a time commitment is it? Things like that.
So for people that sign up, the total time commitment for the study is 10 weeks. Of the first or second phase of 3 weeks, they'll be taking the antiseptic, and then after that, we'll be monitoring them for symptoms and asking them to collect some nasal swabs and such. So the overall commitment is 10 weeks.
So you'll test if they're positive for COVID?
That's correct. Yep. We'll see if even without symptoms there's any evidence of COVID-19, and so you can do that using nasal swabs. But these are not the ones that go up very far up the nose. These will only go a little bit into the nose to be able to detect the virus.
Well, that's a good selling point. I'm very comfortable with the other one.
I thought it was important to mention that.
Is SHIELD an acronym for something?
It is an acronym, but I don't think it relates completely to the way it should. Essentially, it's a study to use antiseptic decontamination for preventing SARS-CoV-2, and somehow it makes it into SHIELD.
Okay.
So this is only for frontline workers. It's not for the general public.
This is only for frontline workers at this point. I think the goal is, if we find that it works, as we hope it will, then the implications are pretty enormous, right? It could be used in schools by teachers. It could be used by the public in high-risk activities. But in order to do any of that, we first have to demonstrate whether it works or not.
All right, if people are interested in your frontline work, is it only UW people?
No, it's nationwide.
Okay.
Oh, wow, that's great.
The SHIELD research study, SHIELD at medicine.wisc.edu is where you can sign up, or call 608-262-6560.
Dr. Safdar, keep up the great work. Stay well. Good to see you today. Thank you for your time.
Thanks for being with us today.
Thank you.